breast health. And no better person than Dr. Kaytlin. She is definitely a naturopathic practitioner who, yes, does chiropractor on the side, but I will tell you, she does so much more. And I would recommend following the Wellness Way in Woodbury because you're going to learn a lot. They have a whole lot going on, and I love all their posts. I love to learn from them. Here's the October specials through Wednesday. The soft gels, 10% off. Who doesn't need those? There isn't one night that I don't have those in me and on me. Believe me, with the Serenity. This is free this month, the Serenity oil. And then love, if you haven't done the Hooga, there is that amazing diffuser that's finally back after many years. And the Hooga, you can buy the Hooga by itself, or you can definitely do the bundle. And it's a beautiful diffuser. This is a Diamond Club event, which means whoever invited you, please reach out to them. Because if you're looking at getting started this month, there's a lot of good freebies out there. And depends on what you're going to get started with. They'll guide you. If you don't know, I mean, you know who invited you, but if they don't have a Diamond Club code, please reach out. But if not, we want to make sure that you utilize their free stuff that they are willing to give. This is a 5-week program with doTERRA, and every Thursday they have, you'll see on Tuesdays, it's for wellness advocates, those people that are basically sharing, and every Thursday is for wholesale customers. And this is going to be for 5 weeks. We're in our second week now tomorrow. So we listened to our second week yesterday, and we're excited to have you be part of this if it's something you're interested in. And personally, I think everyone should be attending these because it's full of great information. Here is next week, Joyce Anday. She talked about her topic last time, finding safety in your body. And she's excited to come back. I'm going to let the cat out of the bag a little bit. Watch for November. I know I kind of told some of you that we're going to have Dr. Hill in October, and he got called out of town for a few weeks to go to another country. But he's down on the calendar and committed to November, guys. So watch the images. And Dr. Shane, rebalancing your gut naturally. And this is definitely going to be Candida. I've heard his presentation. He does a great job. He usually does it on the road, and it's fantastic. So please mark your calendar for the next couple weeks. And without further ado, I'm going to stop sharing. And Dr. Kaytlin is, I'm going to really call her like an expert in this area. And she is going to take over. Dr. Kaytlin, it's all yours.
All right, perfect. I'll just share my screen here. Okay. Does that look good, Sandy?
Yep, if you could make it full screen, that'd be great.
It is full screen on my end.
Okay.
Okay, perfect. So I am Dr. Kaytlin. I'm with the Wellness Way in Woodbury. So we're in Woodbury, Minnesota, so just outside of St. Paul, Minnesota. And what I look forward to talking to you guys about today is something that affects so many women. So it's either, affects you directly. Maybe you've been diagnosed with breast cancer, have been worried about it, have had to get mammograms in the past, or maybe you know someone who has gone through breast cancer, is a breast cancer survivor, or maybe you've lost someone to breast cancer. So October can be a very, good month as far as raising awareness for breast cancer, but we need to ask, are all of these pink ribbons, is all of this awareness actually doing anything when it comes to preventing breast cancer? Because yeah, we're all aware that breast cancer exists. It affects us in our day-to-day life. We've seen it in our friends and our family, but is there any improvement now that we are raising that awareness? So I wanted to share this post from someone that I follow on Instagram, the Natural Minded Mama. So this is about pink washing, which is what we all are seeing in October, is when all of these mainstream brands slap a pink ribbon on their products, or they, get a pink package on there to raise awareness for that breast cancer. So it says on here, if the goal was really to fight breast cancer, maybe they should remove hormone disruptors, known carcinogens, and other toxins found inside their products first. So looking at this KFC, full of inflammatory oils, Milano cookies, Yoplait yogurt full of artificial colors and dyes, Velveeta, toaster strudels, Mike Hard lemonade, all of these things, endocrine disrupting chemicals in perfumes, and they're putting that pink ribbon on there. This is called pink washing. So you look at this and you think, okay, this product, they care about us, they care about our health. This must not be too bad for me. This must not actually have anything that's going to cause breast cancer, where they don't actually change anything. M&Ms are not good for you. M&Ms contain artificial colors that are going to work against your health. And a lot of these products contain those hormone disruptors, carcinogens, and harmful ingredients that can actually contribute to that cancer risk. So we need to be careful in October to avoid these products that have these pink ribbons on them, because a lot of times they actually could be contributing to that inflammation that can lead to cancer. So here's some breast cancer stats and facts. So this I took from the University of Utah Healthcare. I thought this was a really great infographic here. But when it comes to breast cancer, this year, 232,670 new cases of breast cancer will be diagnosed in women. 1 in 8 women who live to the age of 70 will develop breast cancer in her lifetime. 1 in 8. Breast cancer accounts for about 30% of cancers in women, and about 85% of breast cancer diagnosis occurs in women with no family history of breast cancer. Now, they do note on the bottom left-hand side of this infographic that breast cancer's mortality rate has been declining since 1989 due to early detection and improved treatment. So that's what they say is good news. Meanwhile, the actual incidence of breast cancer is going up at an astronomical rate. So yes, maybe they're finding some new ways to help get you to that 5 mark breast cancer survival mark. But more and more women are getting diagnosed with breast cancer and having to go through these horrible chemotherapy treatments, radiation, having to go through and get their breasts removed because they've gotten this breast cancer in the first place. So what is breast cancer? It is a type of cancer that begins as a growth of cells within the breast tissue. So it's actually one of the most common cancers diagnosed in women in the United States, second only to skin cancer. But this doesn't only happen in women. So many men are now being diagnosed with breast cancer. And a lot of it has to do with the increased endocrine disruptors, increased use of plastics that will affect estrogens and lead to men developing breast tissue. I mean, men naturally do have breast tissue, but men are actually developing what we call man boobs. And that is a risk factor for breast cancer as well. And it's important that men understand their risk factors as well as women. So some of the common first signs of breast cancer would be a lump in your breast or your underarm. So it's not always going to be breast cancer. There's, fibrocystic breast changes, the clogged milk ducts, lymphatics, all those things could cause some lumps, but that's one, common first sign. There's an appearance of unevenness in the breasts, potentially itchy rash on your nipples or nipple discharge that's clear, yellow, or bloody. And then if your nipples are pointing inward or you have redness, that's a sign. And then thickening or dimpling or pitting of the breast tissue. So I have an orange on here because if the skin on your breast looks like the texture of an orange peel, that is a really bad sign and you need to get evaluated, because that's one of those cardinal signs that you potentially could have breast cancer. So as far as causes go, we don't have a lot of great answers from medicine. So this is from the Mayo Clinic. The exact cause of breast cancer isn't known. Researchers have found things that increase the risk of breast cancer, like hormones. So think of HRT. If you read the inserts on certain HRTs, it actually says that you potentially could be at increased risk of breast cancer. But not all women who go on HRT are told this. Lifestyle choices, things in your environment, but it's not clear why some people who don't have any factors get cancer and others with risk factors never get it. So it is complex, but also it's going to come down to just your health and your ability to detox, your ability to heal and repair, and what's getting in the way of that health. So how do they actually diagnose breast cancer within the medical system? Well, you start with the clinical evaluation. You go into your medical doctor, you say, hey, I'm a little bit concerned about this, and they'll go through your medical history, they'll do a physical exam, and if they're concerned about it, they'll likely refer you out for some imaging. So the most common imaging would be a mammogram, which is an X-ray of the breast. So radiation is actually one of those risk factors for breast cancer. And this technique, this imaging, actually adds more radiation to that area. However, it can give you more information on if you do have that breast cancer present. Now, if that looks suspicious, they may do further imaging and then they may suggest a biopsy where they're going to take that tissue, they're going to biopsy it, and they're going to see if it potentially could be cancerous. You can also look at CT scans, bone scans, PET scans to determine the stage and whether it has metastasized. So if it's spread to other locations, that's when it can be very, very deadly. So another alternative to the mammogram, this isn't necessarily a replacement, but it's a great screening tool that doesn't give you the radiation, and that is thermography. So this has been FDA cleared since 1984, and it detects subtle heat and inflammation signs, early emerging blood vessels that may be feeding a tumor, because tumors need a lot of blood flow, they need a lot of sugar, and so you're going to be able to detect that on that thermography, but there are other things that it can detect as well. So it's not really a diagnostic tool, but it is a good screening. So according to Dr. William Hobbins, he's an MD, he says abnormal heat patterns are among the earliest signs of a developing cancer. So I have a lot of patients who don't want to do a mammogram every so many years. They do thermography every year as a screening tool. And then if things are looking a little suspicious, they may potentially opt for that mammogram, but usually they just stick with the thermography and they get their hormones and their immune system tested, and they are keeping an eye on everything. Continuous and increasing blood vessel formation in one breast can indicate pathology or other breast conditions. So an increase in blood vessel formation in both breasts, they could indicate hormonal imbalances such as estrogen dominance, direct, directly resulting from stress, nutritional status, or outside estrogen replacement. So it definitely isn't a diagnostic tool, but it's a great screening. So this is all about prevention here on the Mayo website. So prevention, things you can do to lower your risk of breast cancer. So what they talk about here is doing cancer screening. So seeing your doctor, getting a mammogram done, doing a self breast exam. I use the Natural Cycles app to track my cycles, and every month it tells me to do a self breast exam. But what do these techniques actually show you? Do they show you if you're at risk of cancer? Or do they show you that you already have cancer? It's just going to show you that you already have a tumor. And by the time you have a tumor, now you're already playing catch up. Now you might have to be in that medical realm where you might need that medical intervention like chemo, which potentially could save your life, but could also cause a host of health implications down the road. So early detection does not equal prevention. That is the biggest lie we're ever told is, early detection is prevention. No, early detection gives you a better chance of surviving that cancer, but it'd be way better if you didn't get that cancer in the first place, right? So, what can we do differently to actually prevent breast cancer? Well, I want to talk about how we think about the human body, which will really play into how we think about prevention when it comes to things like breast cancer. So, when we think of the human body, I think of a Swiss watch. So, Swiss watch has a bunch of little gears that all have to turn together in order for a watch to function. If one of those gears went missing, if one of those gears was damaged, it would affect how the entire watch worked. And you can't necessarily look at, the watch not working as the entire watch is broken. We need to look at that one gear and what's causing that gear not to work. Same thing with your body. You have your nervous system in the middle. That's like your biggest gear. So that's why chiropractic care is so important. So seeing a local chiropractor to take physical stress off your nervous system so your brain can talk to your body and vice versa. So if you have a lot of subluxations, if you have a lot of interference in your nervous system, that can affect your gut health, that can affect your immune system health, your hormonal health, and that's a big recipe for certain types of cancers, especially breast cancer. Not saying that subluxations cause breast cancer, but that physical stress is going to make it harder for your body to adapt to other stress. But then we also have your other gears. So you have your hormone system, your immune system, your digestive system, your skeletal system, and they all work together for your body to function. And let's say that someone develops cancer, breast cancer. If we're just looking at the breasts and we're looking at the hormones, we could be missing what led to it in the first place, whether it came from the digestive system or from your environment or from the immune system. And that's where you need to take a deep look at the entire body. So another analogy, especially for breast cancer, I like to use is the fireman carpenter principle. There is a time and a place for medication and medical intervention. I'm a big believer in that, but I also believe it's a time and a place. It's not always. So if you went home and your house was on fire like this house, who would you call? You'd call the fire department. They'd come out to your home, they'd spray everything down with water, they would save your home, and it's not a big pile of ashes. However, if you put out the fire on this house, you wouldn't be able to sleep in it tonight. You would need to rip out the wet drywall, repair the roof, repair the windows, get that smoke toxin out. But if you were to ask the fire department to do that, they wouldn't be able to do it for you because they don't have the tools, they don't have the skills, and that just isn't their job. Their job was the emergency situations. So when your house is on fire, you're going to call the firemen. But what does firemen do? They're treating the emergency situation. Medicine is like that. They aren't there to prevent the fire from happening. They aren't there to prevent you from actually getting the cancer. They're there to help you detect it as early as possible so that their medical interventions, their drugs, their surgery have the best chances of actually working. So firemen, emergency, medicine, surgery, they treat the symptoms. They're not treating the causes. So our approach at the Wellness Way, we're like that carpenter. We're gonna come in, we're gonna, rip out the wet drywall. We're gonna figure out what caused the fire or what potentially could cause other fires down the road and guide you on how to support your body so that hopefully you don't end up going down that breast cancer route. So hopefully you never get told, I'm so sorry, you have breast cancer. So, carpenter, we're rebuilding, we're restoring health. We're thinking physical trauma, toxins, and thoughts are the cause of chronic inflammation, and chronic inflammation is the cause of all diseases, including breast cancer. So, trauma, think physical stress. So, that's where that chiropractic adjustment is amazing. PT is amazing. Pelvic floor PT is amazing. I love addressing that physical trauma side of things. But also, we have toxins, which is the biggest thing we usually talk about with breast cancer. But we also have mental stress. So, we're going to dive into toxins and thoughts here and talk about some different things we need to focus on. So, toxins. Is our world more or less toxic than it was 50 years ago? Way more toxic. So let's start from the top here. We've got dental fillings, that have mercury in them, heavy metals, that every time you eat or drink anything hot or cold, it's gassing off mercury into your body. And that's causing massive inflammation. That is bogging down your liver. That can cause, a lot of inflammation throughout the breasts as well. Heavy metals also in our deodorants, aluminum's in deodorant that can clog up those lymphatics. So it's really important to address heavy metals, but also root canals. You guys, if you have a root canal, you need to find a really good biological dentist and get their opinion on potentially getting that root canal removed and replaced with an implant or a bridge. Because those root canals are dead organs. They're dead teeth that they've just filled with cement, left in your gums. And 100% of the time, when they have removed those root canals and tested them for pathogenic infections, they've always had pathogenic infections, viruses, bacteria that can go into your bloodstream and cause massive havoc, especially within your lymphatics. So there is a big connection, potential connection between root canals and breast cancer. It hasn't been completely proven through research yet, but there has been enough smoke to, raise awareness that maybe root canals, you need to consider a different option. Then we've got pollution. You probably wouldn't go out to your local river. So we've got the St. Croix River here in Hudson. You wouldn't go out to that river and drink from it because there's so much pollution that it would make you sick. But also think about your tap water. Are you filtering your water or are you drinking straight from the tap? Because pharmaceutical products, people are taking SSRIs, birth control, they aren't able to fully filter out all of those little molecules that people are peeing into the sewer and ends up in your drinking water. So you're being exposed to chemicals that way. Um, Beauty products, that's a big thing. So think about your makeup, your lotions, anything that comes in contact with your skin. Because if it touches your skin, it gets absorbed into your bloodstream within 26 seconds. And if you aren't willing to eat your makeup, it doesn't belong on your skin. But also think about, what are you spraying? Are you spraying endocrine disrupting, body sprays or perfumes that could potentially be disrupting those hormones as well? And then what are we eating and drinking on a day-to-day basis? Are you eating inflammatory oils? Are you eating a lot of processed dairies and processed foods and soy? Those all can have effect on that immune system. But one thing in particular I want to point out is that sugar consumption is going to increase inflammation throughout your body, and that includes your breast tissue. So researchers are finding more and more links between chronic excess sugar consumption and breast cancer. And our standard American diet is full of sugar, even if you don't realize it. So this is one study you can find on PubMed. This is about breast cancer mortality in relation to food consumption. And it was found that younger and older women differ with respect to such correlation. So older women have a strong correlation between breast cancer mortality and sugar consumption. And then there was a weaker consumption or a weaker correlation with fat consumption. And they also found there's a possible connecting link between sugar consumption and breast cancer with that insulin. So I also have another study about glucose metabolism and glucose transporters in breast cancer. So hang with me here, guys. It gets a little bit in the weeds here. But what they find is that breast cancer is the most common malignancy in women worldwide, and it's associated with high mortality rates despite the continuously advancing treatment strategies. Glucose is essential for cancer cell metabolism. So this is breast cancer, but it's also all kinds of cancer. And I have had patients that have had cancer. They went to their medical doctor and said, "Well, I heard that sugar might, exacerbate my cancer, it might feed my cancer." And they were laughed at by their doctors. Yet it's in the research, it's in medical research, but medical practice doesn't keep up with that medical research. So during the process of glucose metabolism, various glycolytic metabolites like glycine metabolites are produced, and other metabolic pathways such as the pentose phosphate pathway are associated with the process. So it's transported into the cell with some glucose transporters, and breast cancer is showing a high expression of glucose metabolism related enzymes in that GLUT receptor, and it's related to breast cancer prognosis. So if sugar is feeding cancer, why aren't doctors talking about this? So, whenever we have patients who have had breast cancer in the past, we get them tested. We look at how well they're handling their sugars. We look at how their liver is metabolizing their hormones. We're looking at their immune system. And very often, we're recommending a no sugar diet. So, if you want, you could take a screenshot of this. This is what you want to avoid when you're on a no sugar diet. I'm not talking about just, corn syrup and sugar. I'm talking about when you're on a strict no sugar diet, avoiding fruits other than berries, avocados, lemons, and limes because berries have higher fiber, so it offsets the sugar. Starchy vegetables, so avoiding, squash, potato, carrots, beets, cassava. Alcohol, ultra processed foods, rice, soy, pea, whey, and then artificial colors, sugary drinks, cow milk and cheese. So you can do goat and sheep because it's different, but cow is going to be higher in that lactose. Pistachio nuts are high in sugar. Soybeans, beans in general are higher in the carbs, except for the garbanzo beans. Those are fine, and lentils are fine. And then breads and grains and vegetable seed and hydrogenated oils. So keeping inflammation as low as possible. So how long do you stay on this diet? Depends on your testing. So I have some people who do it for 3 months. We retest and they're looking wonderful and they don't need to keep avoiding sugar, but they are going to be more careful about the sugar they consume, like high fiber fruits and vegetables, staying away from processed sugars, sticking more with the things like coconut sugar, maple syrup, things like that. And then some people have to be on a no sugar diet for longer. I've had some people on no sugar for a year and a half, and you kind of get used to it a little bit, but it's just however long it takes for your body to be able to adapt and handle that sugar again. But also pharmaceuticals and breast cancer. There actually are some links between certain pharmaceuticals. I'm just going to point out two of them. The first one is the most common medication most women are taking. Over 60% of women have been on this at some point in their life, and about 40% of women are taking it now, and that is birth control. So oral contraceptives and cancer risk. So overall, these studies have provided consistent evidence that the risk of breast cancer and cervical cancers are increased in women who use oral contraceptives. So women who are currently using oral contraceptives have a 24% increased risk that did not increase with the duration of use. And the risk declined after the use of oral contraceptives stopped, and no risk increase was evidenced after 10 years after they had stopped that birth control. However, women who have ever used oral contraceptive have about 7% increase in the risk of breast cancer. So this is from 54 different studies that they brought in together. But also antibiotics, and almost everyone has had an antibiotic at some point in their life. So this isn't quite as much of a direct correlation as the breast cancer. It hasn't been studied quite as much, but they have started to study it because they've noticed potentially a correlation between antibiotic use and breast cancer. So it says use of antibiotics is associated with increased risk of incident and fatal breast cancer. It cannot be determined from the study whether antibiotic use is causally related to breast cancer or whether indication for use, overall weakened immune function, or other factors are pertinent underlying exposures. So, with antibiotics, what you're doing is you're killing all the infections within your gut, but you are also killing all of your probiotics as well. And 80% of your immune system is created within your gut. So, if you're killing that all off, it's going to affect your immune system and your natural killer cells, which are cells that are going to help protect you from cancer, can be affected. We have to talk about endocrine disruptors. So, chemicals in our cleaning products, chemicals in our makeups and our perfumes, in scents. People are using Glade plugins. My mom would always drench our couch in Febreze because I have four brothers, and those are full of endocrine disruptors. So, this is a study about endocrine disrupting chemicals and breast cancer. This is a systematic review of epidemiology logical studies. So they found that they're ubiquitous. So they're in all kinds of different products, are pesticides, plastics, pharmaceutical agents, personal care products, and food packaging. So buying things in plastic, buying things in bags, heating up your food in Tupperware, guys, don't do that. You want to swap it out for some Pyrex and get glass. But those all have endocrine disruptors and they can all affect your hormones, they can affect your immune system. So, conclusion was we identified certain EDC exposures could potentially elevate the risk of breast cancer. They are highly persistent in the environment and bioaccumulative. So essentially, if you keep getting exposed, it can accumulate within your body. If you've ever heard of those forever chemicals or PFAS, that can just build up and build up and build up. And there's potentially a link to breast cancer development. And they still need to continue to study this to really have a good answer. So, as everyone on this call should know, there's some great alternatives. You're not using Febreze on your couch, you're not using Glade plugins. You have amazing access to the best oils out there that can make your home smell beautiful, can help with cleaning your home, can make you smell wonderful, can help you, clean up stubborn stains, all of those things. Another thing that I love to do is I also use Norwex products as well. So I use microfiber in my home so that, I can use doTERRA products. I can use just water and a Norwex cloth. And I know I'm not using those endocrine disrupting chemicals that could affect my hormones. But also I have three boys. It can affect their hormones. It can affect my husband. It's something that the whole family can benefit from. But also, think about what you're putting on your skin. So I talked about how anything you put on your skin, you absorb within 26 seconds, which is why I partner with Crunchy Makeup. So Crunchy, not only do they make very, very clean makeup that I use every single day and it works really, really well, they also have a really cool section of their website. So even if you don't use Crunchy, you should still go over to their website and go to the top and hit learn and you'll find a huge list of products that are banished ingredients. But they don't just say that they're banishing all these random ingredients, they actually link them below. You can click on them, you can see why they banish it, what is that ingredient, and you can find scientific studies that confirm what they say about that product. So you can do your own research on any products that you're looking for. If you're looking for products without formaldehyde, why are you avoiding formaldehyde? You can look up and see why is formaldehyde bad for you. But then lastly, we talked a little bit about physical stress and that toxic stress but mental stress, which definitely affects women at such a high rate because we care about everything. I'm not saying that men don't, but men are a lot better at compartmentalizing and dealing with that stress, whereas women, we just think on it and think on it and think on it. We have a hard time letting it go. And we're taking on everyone else's stress at the same time. So this is a study about adverse childhood experiences and risk of cancer in adulthood. And they found that having these stressful experiences as a child actually potentially could be a contributing factor for cancer later on. But also think about this, unresolved bitterness, anger, resentment, fear, worry. These are all mental stressors, emotions that can cause physical stress in the body, can cause illness in the body if we don't let these things go. So there's a really great book called Feelings Buried Alive, Never Die. And you can actually look up your different symptoms and see what kind of emotions potentially did you try to bury down that's now coming out in a physical way. And it's a really fun read. But we can actually measure your mental stress. So this is our Dutch test, and we'll talk a lot about the Dutch test because it's my very favorite when it comes to talking about breast cancer and your breast cancer risk. But what we measure here is this is a urine test for cortisol. Cortisol is your fight or flight hormone. So on the left hand here, what we see is this patient, she is that red line, all those like four red dots. And where she should be is right in the middle of the gray. So in between the two black lines. She woke up with a good amount of stress, enough stress to get her out of bed, feel like she has energy. 2 hours after you wake up, you should hit a spike with cortisol because you have your coffee, you're getting up, you're getting ready to go. Then, as the afternoon goes on, your cortisol should be coming down. And then at night, it should be at its very lowest because you need to be able to shut your brain down and go to sleep. Well, for her, her afternoon, she still kept that spike up. And at night, she was wired and had a hard time sleeping, anxious, thinking through her entire day. And she had that imbalance and that stress. And if you can't sleep, you can't heal. If you're stressed out all the time, that puts you into fight or flight rather than rest, digest, and heal. And that's going to tax your immune system. It's going to deplete your hormones and potentially could have an effect on that breast cancer risk. Now, on the right-hand side here, this is a patient of mine who battled breast cancer, survived it, amazing. Now she's coming to me for weight loss. But what we see here is her stress, which is on that bottom right-hand side here. She was on the low end when she wakes up. She's below the chart mid-morning. Afternoon, she's actually normal, and then nighttime, she's normal. But she has nothing to give in the morning. She was so chronically stressed out for so long, her adrenal glands are having a hard time keeping up. So she has a lot of mental stress to address, a lot of insecurities, and a lot of other things she's been holding on to that she does have to work through alongside working on the physical and the chemical stressors that had led to that breast cancer for her. So, talking about the Dutch test, I want to talk about the most important thing, or my favorite thing to talk about with the Dutch test, and that is female hormones. But did you know estrogen isn't a hormone? Estrogen is a group of hormones. And if your doctor has not tested that big group of hormones, they don't know what's going on. They don't know your breast cancer risk. And I have yet to see a patient come in from their medical doctor, even if they did have breast cancer, even if they've been put on HRT, that has actually had more than one type of estrogen tested. So it's time to ditch the pink ribbon. It's time to learn about true prevention, not early detection. You don't want to get that tumor. You don't want to have to get that chemo. You don't want to have to go through that devastation and the fear that so many women go through. So, testing your hormones before the disease comes knocking at the door is a pathway to prevention. So, in addition to estradiol, which is the most common estrogen that's tested, there are 9 others that we're going to test for here at the Wellness Way. So, we look at your estrone, your estriol, and then the 16-hydroxyestrone, 4-hydroxyestrone. There's a lot more than that, and they all show up on that Dutch test, and they all do different things within the body. And depending on which ones are high, which ones are low, that can tell us your breast cancer risk. So the biggest one that people are concerned about when it comes to breast cancer is 4-hydroxyestrone. So this one, if you look at the Dutch test here on the left-hand side, this is where the red arrow is. So you'll see at the top there's estrone or E1, and then that goes down the red arrow to that 4-hydroxy E1. This hormone, you want to push less than 10% of your estrogens down this pathway of your liver. The reason for that is this type of estrogen is considered the most genotoxic because that estrogen metabolite can become a reactive quinone that has the potential to bind to DNA, cause damage, and oxidative stress. And the Dutch test is going to show that pie chart. So it's going to visually demonstrate the ratios of 2-hydroxy, 4-hydroxy, and 16-hydroxy. But the 4-hydroxy estrogen metabolites may increase breast, endometrial, and prostate cancer risk. And yes, we can do a Dutch test on men. It's just a little bit less common. So what do we do? So looking back at this, we've got that red pathway. This patient, she had breast cancer. This is a different patient than the one I was referring to earlier. And she survived breast cancer. We're super excited that she did. But when we ran her Dutch test, we're like, you know what? They never actually addressed what led to the breast cancer in the first place. They never addressed your risk factors. So let's check in. On this Dutch test, she's pushing 37.9% of her estrogens down the cancer-causing pathways. It should be less than 10. She is on her way to developing breast cancer again, or developing breast cancer somewhere else, developing, metastatic cancers. So where we want to help her push her estrogens down is down the green protective pathway. So that's where the cruciferous veggies come in. When you eat cruciferous vegetables, it pushes more of those estrogens down the green protective pathway, so you have less going down the red pathway. So making sure you're eating your Brussels sprouts, your broccoli, cauliflower, kale, radishes. There's so many great cruciferous veggies out there that you should be eating on a day-to-day basis. If you could get, 5 to 8 cups in, that's even better. I highly recommend fermented cruciferous veggies. Like you can ferment Brussels sprouts, you can ferment sauerkraut. And then cooked cruciferous because it's going to be a little bit easier on the gut, but you can definitely do some raw too. So here's another example. This was one of my patients who previously had breast cancer. And you can see if you look at the pie chart, 73% of her estrogens are going down the protective pathway, but 17.5% were going down that red pathway that could lead to that DNA damage and that breast cancer. So we needed to turn things around. Resveratrol is an amazing supplement for slowing down that red pathway. So if you're doing an herb with resveratrol in it, which I always recommend a whole herb, not just resveratrol by itself, so something like Japanese knotweed or golden seal, but golden seal is a little more harsh on the gut, so Japanese knotweed's my favorite. That can help slow down the red pathway and then add in those cruciferous veggies, and you're pushing more down that green pathway. But you have to retest. You need to make sure you don't hang out in this scenario. We can also test your oxidative stress within your urine as well. So here at the bottom, this is the last page on the Dutch test. On the very bottom, there's oxidative stress, DNA damage. So we can measure if that DNA damage process has started. So obviously we want to see within range, low end of range. We don't want to see that high because that is a recipe for potential cancer risk as well. So what is oxidative stress? It is an imbalance of free radicals and antioxidants in your body that can lead to cell damage. So it plays a role in many conditions like cancer, Alzheimer's disease, and heart disease, and toxins like cigarette smoke, environmental irritants can cause oxidative stress, while foods rich in antioxidants can help reduce it. So we got to keep that oxidative stress low. We've got to test those estrogens. You guys, what if every woman, instead of getting a mammogram every few years, got a Dutch test every year? And you could measure those estrogen metabolites and see if you're pushing it down that cancer pathway and turn things around before it turns into a tumor. But guess what? Insurance won't cover that. Insurance will cover your chemotherapy. They'll cover the poison that needs to get used to save your life now that you have that cancer. It breaks my heart that so many women are going through this. I've seen my aunt go through it. I've seen other family members go through it. It's devastating when you lose your hair, when women in their 20s are cutting their breasts off voluntarily because of their genetics. When you could be testing your hormones, testing your immune system, testing your gut to find out Are you on that path to cancer? And if you are, turn that ship around before it turns into cancer. Guys, there's so much you can do. And it's absolutely devastating that chemo is our only choice. Early detection is our only choice. It isn't our only choice. However, that's what insurance will cover. And if you want better for yourself, you have to find someone who is willing to put in the real testing, who's really willing not to guess, but is actually going to find out what is stressing out your body. So, what makes us so different? Well, we have this crazy idea that the body doesn't make mistakes. People think I'm absolutely crazy, but I tell people breast cancer isn't a mistake. Breast cancer is your body trying to protect you from those endocrine disruptors, trying to protect you from those toxic chemicals, trying to protect you from that mental stress. But eventually, it's going to be a problem for you. So let's remove those stressors. But I love to use this example of how your body doesn't make mistakes. So imagine that you're living in Minnesota or Wisconsin and it's the middle of February. It is negative 15 degrees outside and someone drops you off in the middle of the woods. Well, what are you going to start to do? You're going to start to shiver. And the longer you're outside, the harder you're going to shiver, the more your teeth are going to chatter. It's going to get really annoying. It's going to be extremely uncomfortable. But what if someone said, you look really uncomfortable shivering. I have a pill that will make you stop shivering. Well, what would happen if you took that pill to stop shivering? Well, medications work, you would stop shivering, but then what happens? You were shivering to shunt the blood from your extremities to your organs because you don't need a finger to live. You don't need your toes and your legs to live. Yeah, you're going to get frostbite and lose your fingers, but at least your heart's still functioning, your lungs, and you can still survive. But if you take that pill and you're not shivering anymore, you're going to die a lot faster. Same thing with things like breast cancer. Your body is adapting to those stressors and trying to keep you alive in the way that it knows how. But eventually, it's going to lead to that breast cancer diagnosis. It's going to lead to the illnesses. It could potentially lead to death. You need to address those stressors. So we don't guess, we test, whether it is looking at your hormones, especially if you're on HRT, you absolutely need a Dutch test. Sorry, guys. A Dutch test is going to show you what you're doing with that HRT. Because if you're flooding your body with estrogens and testosterone that's converting into estrogens, and all of those estrogens are going into that cancer pathway, you are feeding that cancer or that cancer process. And you need to know that if you're on HRT. I think it should be required for every person on HRT to get a Dutch test. Checking on your gut health. With majority of your immune system being created within the gut, that's extremely important. Are you exposed to mold? Are you exposed to heavy metals? Do you have food allergies that are causing chronic inflammation for you? Are you mentally stressed all the time and you need to figure out how to support your adrenal glands and, prioritize things? We test all of these things at our office. But I wanted to send you guys away with a few tips just in general on what you do to support your hormones, especially when it comes to breast cancer. But number one, take time for self-care. Mental stress is a huge contributing factor for a lot of women when it comes to breast cancer, men too. So making sure to say no, no is a complete sentence. You don't have to do something for other people every single night of the week. You can take time for yourself. Go do some yoga, go for a walk, go for a hike, read a book, get a massage. Just do something for yourself every now and then. Tip number two, nutrition is key. So cutting out sugar is a great first step, but also you could be eating foods that are inflammatory to you that are healthy for other people. For example, I have a patient who is allergic to cabbage, and I recommend a lot of my patients to have sauerkraut because it's so healthy for you. But for her, it's actually inflammatory. So getting your food allergies tested is important. And this was one of our patients who had survived breast cancer. She was allergic to 20 different foods. And this type of allergy is a chronic inflammation causing food allergy that you typically don't know because you don't have an instant reaction. But it causes 70 to 80% of your immune system to attack that food and leads to chronic inflammation, which is the driver of chronic disease. So you see for her, she was allergic to lettuce, ginger, blueberry, cranberry, cinnamon, all these amazing things that are so good for you. For her were actually inflammatory and she needed to cut them out of her diet. Tip number three, avoid endocrine disruptors. So obviously pesticides, sticking with the clean 15 and the dirty dozen. If you don't know what that is, the clean 15 are the 15 fruits and veggies with the least amount of pesticides if you buy them non-organic. So things like avocados are on the Clean 15 right now. But then the Dirty Dozen, you want to get those foods organic 100% of the time because they have a high amount of pesticides on them if they're not organic. Number two, birth control. Um, Birth control, I think, is one of the worst things for our hormones that we could possibly do. And more women and more little girls are on birth control to manage their cycles, to manage their acne, their mood, and that can lead to endocrine disruption. Fire retardants, phthalates, BPAs in plastics, percolates, arsenic, nonstick cookware, if you still have it, switch to cast iron or stainless steel. And then mercury and dioxin in certain injections that some people receive. So toxins within medical interventions. So I wanted to talk about some doTERRA products that are really great to add into when it comes to oxidative stress, mental stress, getting toxins out of your home. So I want to start with the foundational wellness and Terrazyme. So your gut health is so important because so much of your immune system is created there. And if you have healthy hormones and healthy immune system, you are not going to get breast cancer. Because if you're processing your hormones correctly, if your immune system, you have a good amount of natural killer cells and other cells that are going to help fight against cancer cells, your body can adapt. So making sure to support your gut health with that PB Restore, E Omega Plus, the VMG Plus, the Terrazyme, all very important foundational wellnesses. Now, frankincense or boswellic acid complex. So this is really amazing for promoting healthy inflammatory responses within the body. So chronic inflammation is not your friend when it comes to cancer risk. Research also suggests it may protect against oxidative stress, which is what can lead to that cancer down the road. And a case study and preclinical research suggests it may support cellular health and renewal. So this is something that we actually use in our office. We love this when it comes to inflammation in general, oxidative stress, but also just in general, joint pain too. So DDR prime cellular complex, so that's going to promote a healthy response to free radicals. You know, radiation is a really big thing when it comes to breast cancer as well. So never keep your cell phone in your bra. A lot of women used to do that. Just makes me cringe. But that can be a part of that free radical response, supporting a healthy cellular response and may help promote healthy cognitive function. And it can provide immunity and cellular support with a broad spectrum activity, antioxidant properties to counteract that DNA damage, counteract those free radicals, and then supports healthy response to oxidative stress. Pink pepper, this is going to be very supportive for metabolism and immune function, also cellular health, and very calming to the immune system. And it is very supportive for healthy digestion too. And then we also have the Revitazen Plus Advanced Organ Detox Complex. So this is very supportive for long-term, everyday liver, kidney, colon detox support. So it is really great for, you know, instead of like a harsh cleanse that can disrupt your digestion, cause a lot of those die-off symptoms, unwanted elimination, the diarrhea, loose stool, this works with your body to help with what it was designed to do. And it doesn't have dairy, soy, wheat. It's been tested for heavy metals, pesticides, and microbials, which you want to keep out of your body. There's also the detox blend as well. So also very supportive for the liver, kidneys, and digestive tract. Now, what do we do about the cleaning products? Norwex is one of my go-tos, but also the doTERRA Bod, the laundry pods, the all-purpose cleaner, you know, the surface spray, being able to replace all of those chemicals with something that's actually going to support your home and support your body and support your health. And I do have some of the oils listed on the right here included in that blend. And then this is an herb called passion flower. So a lot of women who have been through breast cancer have been put on aromatase inhibitor. So what aromatase inhibitors do is they prevent your testosterone from converting into your estrogens because they believe if you keep turning your testosterone into estrogens, then you're going to push it down that cancer pathway and it's going to lead to breast cancer for you. First of all, let's address the pathways. But second of all, there's herbs that are great aromatase inhibitors. So passion flower is my favorite one. So it is going to slow down that pathway from testosterone to estrogens. It's going to calm occasional feelings of anxiety, so it can kind of make you feel a little bit more uplifted. It provides antioxidant and anti-inflammatory activities, supports feelings of well-being, and encourages relaxation and promotes restful sleep. But you want to make sure that you actually get your hormones tested because, for example, for a woman who has PCOS and has high testosterone, if you are taking passion flower, you're only going to make that worse. So you want to get your hormones tested before you take any supplements, any herbs, just to make sure that you're taking the right thing. So I want to thank you guys for hanging out with me tonight and really talking about breast cancer during this month of October. So I wanted to offer you guys a discount on a new patient appointment. So whether you are located in the Twin Cities area here in Minnesota, or you are living in Texas or Oklahoma or somewhere that's warmer, you could still be a patient because we do virtual care as well. So we can do everything we do in the office over the phone, minus the x-rays. But I want to give you guys a discount on our new patient appointment. So instead of $199, it would be $99, and that includes a review of your health history and past results. So if you have any past testing from the last 2 years, especially, send that our way. We'll take a look at it and take it into consideration with our recommendations. Do an exam, full spine x-rays if you do come in person, and then recommendations for your next steps as far as what would be the right testing for you. So I'm going to put a link in the comments here at the end. And the first 10 people to click the link will turn off by the end of the night for sure. But the first 10 people to click on the link will get a free doTERRA discovery call where you just get to chat with me, ask any questions, find out if we would be a good fit for you, and really just a no obligation way to learn a little bit more. So definitely follow the link for that. I'll put it in the comments here in just a moment. Also, we would love if you would connect with us. So thank you, Sandy, for shouting out our social media. We post different videos on different health topics every single day. So there's myself, I'm Dr. Kaytlin. We have Dr. Jen, and we just hired a new doctor on, Dr. Brittany. So you'll be seeing her on our social media very soon. But we all do this different way to health, this perspective that your body doesn't make mistakes, and we're not going to guess with your health. We're going to test, and we're going to be specific. So follow us on Facebook, Instagram, TikTok, really all the social media platforms. We're on there. But you can also give us a call at 651-330-9453. Send us an email, check out our website. And we are located in Woodbury, Minnesota. But again, we do everything virtually as well. So don't let that deter you from, getting that information, finding out, are you on that path to breast cancer? What can you do to turn that around? And what can you do to have truly restored health? All right, you guys, I'm going to stop sharing here. And I'll put the link down below.
Great, and I will finish up, Dr. Kaytlin, so you can look at some of the questions. Thank you so much, and I'm excited to hear some of the questions. I've even submitted a couple, but please, if you haven't already, join the Facebook group. I will tell you, I talked to Gabriella this week. She asked that we be patient for the recordings, all that she's got going on. She said, give her till for sure Saturday. That might be out there on Friday, but for sure. And if you join the email group, I love it. I don't ever go out there and look and ask and dig. It's just sent in an email, which I absolutely love. And you can also find it on my Facebook group as well. I put it out there as soon as I get it. So definitely join the Discovery Essentials Facebook group. There's an abundance of education, things going on. They're keeping us abreast of things happening, which today leadership registration is out there as well. And again, the email list is there, bit.ly/email list. DE stands for Discovery Essentials. Or please click on those QR codes. I would recommend that you check out your progress toward graduation tonight before you complete the form. And many of you may be graduating tonight. So go to the bit.ly/grad progress 2025. If this is your 10th, then when you complete the form, you let them know if you want one of the classes or if you want the oil. So within the next hour, go to bit.ly/continuing ed 2025. I was just out there sharing a number of recordings this week to 2 different folks in this permanent library. There is more out here than you can believe. So either the bit.ly/permanent library, DE stands for Discovery Essentials, or click the QR code there to share and learn more from us as well. Um, the graduation gifts, if this is number 10, um, you have to put in the teachable courses, so one of those two, and you can gift the essential oil certification to someone if you've already done it, or you can get two of these oils. So definitely check this out. These oils are not super expensive. These over here, they're $97 each. So something to really think about. Three types of folks that love to be with doTERRA: those that want to live, share, and build. And who wouldn't want to live that healthy lifestyle that Dr. Kaytlin talked about tonight? 3 ways to purchase, again, retail, wholesale, and below. And those of you that listen to me every single week, yes, below wholesale is the only way to go. So again, I placed my order on the 4th, which was Saturday. And so I went through and did inventory last Thursday on the 3rd. So I guess a week and a half ago already. And looked at what we have and what we need, and amazing things for substantial savings. So please, just a reminder, go do a inventory check before you place your monthly order and see if there's something more. I absolutely love this. I'm on the foundational. I do Terrazyme every day. And these are just good. And if nothing more, what an amazing little gift basket or a gift that you can pay this forward for the holidays. And keep in mind, on November 1st will be the holiday item. So watch your package when it comes this month as well. Here is some more. Love this one as well. You can create your own. You can do the Meta Power kit or anything. And if you're looking at the 150, you can pick from some free items there as well. We are out here, everyone that's on the call, to change the world, one drop, one person, one community at a time. My phone number is there. You can call or text. And my email is there as well. Kayla will put that in the chat. I am going to stop sharing. I'm going to ask Dr. Kaytlin, and you must be on the call.
Recording stopped.
So if you win and you hang up, I heard somebody last week send me something, said, well, I heard I had won. Well, if you aren't on the call, you're not really qualified. So Dr. Kaytlin, pick a number from 4 to 94. And then everyone that's on the call, watch, Kayla will put the name in the chat. So what do you pick, Dr. Kaytlin?
10.
10. All right. So Kayla will take care of that. And how about some of the questions that came in?
Okay. Do you recommend thermography over a mammogram? That's kind of a hard thing. So I would never say that thermography is going to replace a mammogram. Me personally, I would use thermography as a screening tool. And then if I ever got into that situation where I highly suspected there could be something like breast cancer, I would take the radiation of that mammogram just to be sure. But I'd rather do thermography as that general screening tool and avoid all that radiation.
And is that annually?
I believe so. I believe a lot of people do it annually, but I'm not 100% sure. But I do have some patients that go every year.
Thank you.
Let's see. Our oral health is so important and dental implants are so expensive and it's not covered by insurance. Yeah, definitely being proactive as possible. I'm not a dentist, so I'm definitely not an expert on that, but I love biological dentists and using all of their knowledge. And it looks like there's going to be one presenting here on December 3rd, which is great. All right, let's see. What gas is let off from metal teeth fillings? So, metal teeth fillings are amalgam. They're a mix of different metals, but mercury is the biggest one that's going to be gassed off. So there's actually some studies where they put metal fillings in the mouths of sheep and kind of measured like where did that mercury go? Did it spread? And they found tons of that mercury within sheep's gut. And then they found that yeast loves to eat mercury, and so then they'll have yeast infections in their gut to protect them from the mercury. So it's a really interesting topic to study, but that metal can cause so many issues within your body.
Dr. Kaytlin, do you have any tests, or how does someone find out about the heavy metals?
We do have some heavy metal testing, so if that is something someone's interested in, we definitely could get you set up with testing for heavy metals for sure. Let's see. Even Tupperware, the brand. Yeah, I kind of picked on it a little bit, but any of the plastics, you don't want to heat that up. Me personally, I unplugged our microwave. We don't use it unless we use it for a heat pack, a rice pack. It's better to reheat your food in like a, toaster oven or in the oven, or I've even heard of people doing it in an Instant Pot. Just trying to do it in a way that isn't going to damage the integrity of your food or cause plastics to go into your food. Norwex and doTERRA go hand in hand, in my opinion. I agree. And then aren't microfiber shedding plastics because they are from synthetics? So I'm not 100% sure on that. I do know a lot of microfibers are, but I think there are some that are much better than others. Um, Diane, I need oils for mental stress. Yes, so definitely reach out to Discover Essentials for sure. Reach out to Sandy. Veggies, yeah. So cruciferous veggies, you need them. If you're a woman, you need all the cruciferous veggies. And then Lane is asking Japanese what? Japanese knotweed. So Japanese knotweed is an herb that contains a lot of resveratrol, which is going to help slow down that pathway going, sending your estrogens down to cancer or to DNA damage, I should say. So that's a really great one if you are pushing that pathway. It's also great if you've been bit by a tick to take Japanese knotweed. That's something that helped me recover from Lyme. Linda, what was the name of the book? Feelings Buried Alive Never Die. All right, Lane, do these tests help determine those who get triple negative breast cancer? I have a friend that has this, and is prevention the same for all of the different types of breast cancer? I would guess yes. No, it depends on what stressor is leading to your breast cancer. So we barely touch the surface of different things that could contribute to breast cancer, but we could have 10 people who have developed breast cancer and we could have 10 different stressors that led to them getting that cancer. So for triple negative, where I would probably look first, depending on the patient's history, would probably be a really good quality immune panel and make sure that that immune system can actually address that cell, the cancer cells themselves, rather than going down the estrogen route. But definitely there's a time and a place for both. All right. And thank you for sharing the slides, guys. All right, Darylyn, if you grow your own organic veggies, are the dirty dozens still considered dirty? No, because you're not spraying them, so that's okay. It's just really when you're buying them conventionally. I do try to get organic seeds when I'm growing because there is, a lot of GMO. So trying to be careful with the seeds that you purchase. All right, you're welcome, Christy. And then Valerie, do you recommend using frankincense orally or topically? It can be used both ways. And then what is the cost of the Dutch test? Oh, that is a great question. Off the top of my head, I'm not 100% sure. I want to say $255, but I know it's less than 300. And just imagine if you did a Dutch test once a year, if you invested in your health, that $300, and you were able to turn things around, you didn't end up with chemo, you didn't end up with radiation, and with that mastectomy, like it's well worth that money. All right, Susan, thank you so much. Highly recommend working with Dr. Kaytlin's office. She's a patient. They've been so helpful. Well, we're thankful for you. All right. And then so this is Mary, how would you rate thermography for early detection? I would say it's a really great screening tool. I do have to be a little bit careful. So I'm not a medical doctor. I don't do thermography. I don't do mammograms, all those things. But me personally, and what I typically recommend for my patients is thermography is a great screening tool. But if you are, nervous that potentially you could have cancer, we've already done the Dutch test and you're pushing down that pathway, things are looking not so good. I believe there are some pros and cons to that mammogram. Sorry, guys. Um, okay, what was that last invigorating aromatase? So the last herb that I talked about was called passion flower, and it does something called aromatase inhibiting. So it's going to slow down converting your testosterone into your estrogens. So for women who are pushing too much of their estrogens down that red pathway, and we just need to stop it before it turns into a bigger problem, that could be a very beneficial herb as you're trying to correct those pathways within the liver. And then Susan answered Joe's question, but other than pink pepper, what are the top oils for breasts? cancer. Yeah, pink pepper, frankincense, grapefruit. Great. Do you have a price list for the testing? So, Bobby, if you go through the link and schedule that free 10-minute discovery call, or anyone who wants to either call our office or email, just ask for our lab fee form and we'll send you our most common labs and their prices. So, we're very upfront with our prices. We never have any hidden bills at our office. And we are completely cash based because we don't want insurance to tell us that we can't test your hormones because it's not covered by insurance. And we don't want you to get the insurance price for a Dutch test, which would probably be close to $2,000. All right. Would pairing an ultrasound and thermography together be helpful? I can't really answer that question. I don't know how well the ultrasound will help with that. That's a great question, and I would love to get the answer for you, but off the top of my head, I'm not sure. Perfect. And I think that's it.
Wonderful. Thank you, thank you, and thank you. I know there's been a couple questions about muscle testing. Please reach out to me. My phone number is in there. Kayla's put it out there. Reach out and we'll schedule a Zoom and I'll show you how. One other question, how often is mammogram safe?
Um, Safe is kind of a loose term, but I would need to look at the recommendations again. I know they change, but I wanted to say it's about every 5 years or so, but it could be more frequently than that, potentially. But it is an X-ray and it is very targeted to that breast tissue. So you do have to keep that in mind that you are radiating that breast tissue, which potentially could cause more problems if you do have a tumor.
Great. So everyone, please unmute and share your full appreciation